everyone. Today, Dominika and I are going to talk to you about drug consumption rooms. They're called many things: safe injection sites, drug consumption rooms, overdose prevention spaces, but they're all essentially the same thing: a safe space for people who use drugs to inject or take their own drugs under supervision in clean, sterile conditions. They help reduce deaths, they save the taxpayer money on things like ambulance call-outs, hospital admissions and council-led street cleanups, and they've also been shown to increase the uptake rates of rehabilitation and detox programs. There are loads of myths and misconceptions out there about them still though, so let's talk today and bust some of these myths.
Another myth you're likely to hear around these is that they don't work. I'm not really sure where this comes from. It certainly isn't backed up by any facts. And don't work how exactly? Drug consumption rooms or supervised injection sites have been shown to have positive effects around the world. There are effects that can benefit the whole surrounding area, such as reduced drug-related litter with less discarded needles around the streets, but they also have a substantial impact on the people who use the sites themselves. They provide sometimes critical medical care for some of society's most vulnerable citizens, those who can be hard to reach or are socially marginalized, who wouldn't normally seek medical care even if they needed it. Supervised injection sites are also places where those who are ready and would like to get treatment can be referred to some. Studies have shown that these facilities actually increase the number of people going into treatment. And crucially, by providing a sterile environment, therefore reducing the risk of infections such as HIV and hepatitis, and by the presence of trained staff on hand if anything was to go wrong, drug consumption rooms save lives. At Insight, the supervised injection site in Vancouver, there have been over 3.6 million visits to inject drugs since the site first opened in 2003, and there have been over 6,500 overdose interventions with no deaths. In fact, there hasn't been a single death at any of these facilities anywhere in the world.
One of the most commonly heard myths about drug consumption rooms is that they actively encourage drug use. This is just not true. Critics say that supervised injection sites can encourage drug use and bring crime to surrounding areas. In fact, they have been found to reduce drug litter, and studies have shown that opening drug consumption facilities have never resulted in an increase of arrests for drug trafficking, assaults, or robberies. Researchers have also found no evidence of the honeypot effect at all happening around overdose prevention centres. And, in a study published in The Lancet, researchers found that the fatal overdose rate sharply decreased in and around the surrounding area of drug sites.
Another myth that seems to have no basis in available evidence is that they are a waste of money. In fact, analysis of costs consistently shows that there are healthcare savings to be made for every dollar spent. One such analysis from San Francisco shows that every dollar spent on a supervised injection site saves $2.33 in areas such as emergency medicine and law enforcement, saving a total of $3.5 million per year. Similarly, at Insight, the site in Vancouver, it has been estimated that the closure of the site will cause a spike in HIV infections that would cost $17.6 million in lifetime HIV-related medical care. This greatly exceeds the site's operating costs of $3 million a year. So despite the evidence from existing sites, drug consumption rooms remain controversial. In the UK, for example, no such rooms exist. The issue seems to be less about facts and figures and what works and doesn't work, and more about moral and ideological issues from setting up such sites. Many politicians see advocating for these as political suicide and fear from backlash from voters and the media.
The myth you hear all the time is that it will just never work in the UK. We hear constantly about how although drug consumption rooms may work elsewhere, they will never be successful in Britain, but there is no reason why they shouldn't be. Many countries like Portugal and Switzerland have seen drug deaths drop massively since introducing these rooms. Peter Krykant has been operating a life-saving, but technically illegal, drug consumption room out of a van in Glasgow where, on average, there are 4 injections every single hour. His work has been constantly frowned upon by governments and authorities, and even once he had police force efforts wasted on observing his van. Peter has supervised hundreds of safe injections and is working at reducing the rate of HIV in Glasgow, which is experiencing its biggest peak in 30 years, all through his safe injection room. Across the world, there have been thousands of life-saving interventions, and no deaths at all in any of the hundreds of safe drug use rooms. Peter has found his impact no different, having saved at least 5 lives already from his humble van. In the UK, there are 16 drug-related deaths each day, and with proper drug consumption spaces, this would just not happen. The time has come to open up the conversation, and the Misuse of Drugs Act needs to be changed to allow vital work like this to be carried out legally and safely.